Arrhythmias are caused by an abnormal pacemaker activity or abnormal impulse propagation through the myocardium. Many factors can precipitate or exacerbate arrhythmias, including ischemia, hypoxia, acid-base disturbances, and electrolyte abnormalities. Oftentimes, it needs to be treated because rhythms that are too rapid, too slow, or too asynchronous can reduce cardiac output. Some arrhythmias can even precipitate lethal heart rhythms like VFib. Antiarrhythmics, therefore, can be life-saving. They're used to decrease the automaticity of ectopic pacemakers, inhibit conduction, and reduce the excitability of cardiac tissue. From now on, when you think of the classes of antiarrhythmics, I want you to imagine musicians keeping us at the right rhythm and tempo. A soloist for class 1, a duet for class 2, a trio for class 3, and of course, a quartet for class 4. I think we need a little less conversation, a little more action, so let's get to it. Since my baby left me, I've found a new place to dwell. It's down on the end of Lonely Street. You know the place. To represent Class 1 antiarrhythmics, we have our soloist serenading the residents at the Heartbreak Hotel. He looks pretty lonesome tonight, don't you think? Well, he's a regular here, so let's listen in to his ballad of heartbreak and dysrhythmia. Take a look at his microphone wire. It looks vaguely familiar, almost like a cardiac action potential, right? Let the microphone stand represent the upstroke phase 0 of the cardiac action potential, while the wire represents phase 2, the plateau phase, and phase 3, the repolarization phase. As we'll soon illustrate, each subgroup of the class 1 antiarrhythmics affects the cardiac action potential in a unique way. What better way to suppress your sorrow than by downing an entire jar of peanut butter? Because peanuts are our recurring sketchy symbol for sodium, a peanut jar represents a channel for sodium, if you will. This sodium channel is next to the upstroke of the microphone stand to remind you that the cardiac action potential upstroke, phase 0, is dependent on sodium current. Not only that, see how our lonely soloist clutches tightly onto that sodium channel? This should remind you that type 1 antiarrhythmic drugs exert their effects through sodium channel blockade. Focus again on his left hand, tenderly holding that microphone as he tips it forward. His action of tipping the microphone stand forward depicts decreasing the rate of rise of phase 0. By blocking sodium channels, all type 1 antiarrhythmics slow the upstroke of the action potential, which slows conduction of the action potential through the tissue. The upstroke of the cardiac action potential will almost look tipped over with a decreased slope. The last thing to notice about his peanut butter jar is that it's open. The spoon inside represents a little inactivating gate sticking into the channel. Our soloist here, clutching the open but inactivated jar, should remind you that type 1 antiarrhythmics bind readily to open or inactivated sodium channels, but poorly to channels in their resting state. You see, functionally, the sodium channels in the myocardial membrane can assume 3 different states over the course of the action potential. Depolarization to threshold opens the activation gate and the channel is open. Hello, upstroke. But almost as soon as it opens, the inactivation gate, or in this case, the spoon, swings shut and the channel is inactivated. It will remain inactivated throughout that calcium current-induced plateau, phase 2, and during that potassium current-induced repolarization, phase 3. It is only after repolarization that recovery from inactivation takes place and the channel goes back to its resting state. So it turns out that sodium channels in rapidly depolarizing tissue spend the most time in the open and inactivated states, which allows more time for binding of these agents. Because of this, class 1 antiarrhythmics are said to have use dependence or state dependence, meaning that tissues undergoing frequent depolarization are more susceptible to blockage. This is useful when trying to get rid of those tachyarrhythmias while minimally affecting the electrical activity of normally polarized heart tissue. Let this tachycardic ticking heart watch next to the microphone remind you of this use dependence, Imagine that when tissue is depolarizing more rapidly, during rapid tachycardias, for example, the drug will bind even more, and he'll tip the mic forward even more, slowing down that upstroke. Also, drugs that bind more strongly to the sodium channel will experience more use dependence than those that bind more weakly. We will emphasize this point when we meet each resident at the hotel. Some will be gripping that peanut butter jar tightly and will exhibit high use dependence, and others will grip the jar more tenderly and exhibit low use dependence. Now let's focus once again on that plateau phase and repolarization phase. Notice the potassium banana themed print on the curtain in the window behind. This represents the presence of a potassium current gradually building during the plateau phase and working in full force during the repolarization phase. Think of potassium current as bringing the curtain down on that plateau phase to repolarize the myocardium. Why the sudden interest in potassium? Well, it turns out that many of the type 1 antiarrhythmics affect potassium channels as well, changing the duration of phase 2 and 3 of the action potential and hence the length of the refractory period. So throughout this sketch, keep an eye on those banana curtains and how they're affected differently with each agent. Alright, take a look up at the sign for the Heartbreak Hotel. Notice that the atria, ventricles, and a segment of neon lighting fittingly reminiscent of the His-Purkinje system. Let these lights serve as a reminder of where we see the cardiac action potential in the heart, and therefore where the type 1 antiarrhythmics act. Specifically, notice that we're not talking about the SA and AV nodes. The nodal action potential is different. Its upstroke relies on calcium current instead of sodium current. We'll get to the SA and AV nodal action potential in our videos covering type 2 and type 4 antiarrhythmics. Whoa, check out the crack in that broken heart. Notice the shape of it looks like an ECG tracing. You've got the P wave bump, the QRS spike, and the T wave bump. But look at the size of that QRS. It's huge. Now that's a broken heart. Remember that type 1 antiarrhythmics all decrease the slope or slow down the upstroke of the action potential in the myocardium, and hence decrease conduction velocity of the action potential. On the ECG, this is seen as a widened QRS complex due to the increased ventricular depolarization time. Okay, think again back to that tachycardic heart watch being held by the hand tipping the microphone. Since tissues experiencing more rapid depolarization will experience more sodium channel blockage and a slower upstroke of the action potential, these tissues will also evoke a wider QRS complex on ECG. In fact, if a patient is on a type 1 antiarrhythmic medication, they can expect their QRS to widen as their heart rate increases, due to the stronger effect of the drug. Cool. This will be more apparent with the drugs that bind the strongest to that sodium channel. After we meet the inhabitants of the Heartbreak Hotel, you'll be able to distinguish exactly which drugs are binding tightly, and so have a greater effect on that cardiac action potential upstroke and on that widened QRS. Okay, this 3-story hotel has floors 1A, 1B, and 1C for each of the subtypes of Class 1 antiarrhythmics. Let's start with the lonely residence of floor 1A. And here she is, the runaway prom queen. Looks like things didn't turn out as planned at the high school dance, and she checked herself into the Heartbreak Hotel to eat away her sorrows. Let this dining queen remind you of the drug quinidine and our first type 1A antiarrhythmic. And next door, itching like a man on a fuzzy tree, it's the prom king, procainamide, who booked a room the moment he realized he may never again see his beloved queen. Boy, could she run fast, or maybe he's just a little slow. Either way, it's a sad story. He sits in his room all day and night, alone, reading the headline over and over. Prom queen disappears. Let the word disappear remind you of the drug disopyramide, another type 1A antiarrhythmic. For class 1 antiarrhythmics, sodium channel binding strength goes like this. 1C binds stronger than 1A, which binds stronger than 1B. Therefore, we've made the queen gingerly holding up that sodium channel peanut butter jar. She's not grasping it and she's not dropping it. It's somewhere in the middle. You'll see. This results in an intermediate use dependence and a moderate slowing of the action potential upstroke. Also, take another look at the curtain being lifted by the prom queen. Remember that this curtain represents the potassium current present during the plateau and repolarization phases. Well, besides blocking sodium channels, type 1A antiarrhythmic drugs also block these potassium channels, allowing the myocardium to be depolarized for longer. Just like the curtain getting pushed aside by the queen, this inhibited potassium current causes a prolongation of the action potential, which means a prolonged effective refractory period. The type 1A antiarrhythmics are used in many kinds of arrhythmias found in the atria and the ventricles, that is, supraventricular tachyarrhythmias and ventricular tachyarrhythmias. Notice how both the atria and ventricles of the 1A sign are lit up, indicating that these drugs are effective at blocking arrhythmias in both these areas. A specific example of when you might use a class 1A antiarrhythmic is in the treatment of Wolff-Parkinson-White syndrome. This is symbolized by the high school pennant hanging outside the window of these two high school lovebirds. Turns out they go to Wolff-Parkinson-White High School, home of the Wolf Pack. Wolff-Parkinson-White is a supraventricular tachycardia that involves extra signals traveling through an accessory pathway outside the AV node. Type 1A antiarrhythmics can block conduction through that accessory pathway. One of the notable side effects of quinidine specifically is a syndrome of headaches, dizziness, and tinnitus called synchonism. Let these tin cans scattered on the balcony remind you of the tinnitus component of synchonism. She's not the tidiest of dining queens. Rarely, quinidine can cause immunologic reactions leading to thrombocytopenia, so in front you'll notice that our dining queen has broken some plates out on the balcony during her feeding frenzy. Wait, she hears someone coming from the king's room. Wait, has she been spotted? Oh, phew. It ain't nothing but a hound dog. All the commotion out on the balcony has gotten the attention of the prom king's only remaining companion, his pet wolf, a lupus wolf, that is. Remember that long-term procainamide therapy will lead to an increased anti-nuclear antibody titer and may cause a syndrome resembling lupus erythematosus. Symptoms of drug-induced lupus can include arthralgia and arthritis, or less commonly, pleuritis, pericarditis, and parenchymal pulmonary disease. See that dartboard hanging close to that disopyramide newspaper headline? It looks like someone has given up on the concept of love. Let these darts deflating the already failing floppy heart remind you that disopyramide can cause or exacerbate heart failure. At toxic concentrations, this drug has negative inotropic effects, not good for a failing heart. Remember too that most antiarrhythmics are also arrhythmogenic. Type 1A antiarrhythmics can cause QT interval prolongation, which may precipitate torsade de pointe arrhythmia and syncope. We'll represent this twisting of the points with a twisted party streamer marked with the torsade's ECG tracing. QT interval is prolonged because class 1A agents prolong the cardiac action potential. This is because type 1A antiarrhythmic drugs also block potassium channels, allowing the myocardium to be depolarized for longer. This was depicted by the potassium curtain getting thrown aside by the prom queen. Anytime the action potential is prolonged, you can prolong the QT interval and precipitate torsades. We will encounter potassium current inhibition again when we discuss the class 3 antiarrhythmics. For now, just remember that whenever the potassium curtain is inhibited and thrown aside, prolonging that action potential, this can show up on an ECG trace as prolonged QT. Well, this story isn't going to have a happy ending. Let's move upstairs and see if this other couple is having any better luck. On floor B, we will now become acquainted with the class 1B antiarrhythmics. And it doesn't look like we're off to a good start. This gal definitely looks all shook up as she pulls in that curtain to hide from her lover. Now I see why. Probably a jerk. Good riddance. Let the word lied remind you of the drug lidocaine. And it looks like her tow truck driving ex-boyfriend took a break from his graveyard towing shift to beg for forgiveness. The name friendly towing should remind you of the drug name phenytoin, an anti-epileptic drug that shows some type 1B antiarrhythmic properties. And lastly, let this proudly displayed Mexican flag remind you of the drug mexilatine. Yep, our cheated hotel guest traveled all the way from her home country of Mexico to check into the Heartbreak Hotel. Class 1B drugs bind less avidly to sodium channels than the other Class 1 antiarrhythmics, so take a look at the sodium channel evoking jar of peanut butter on the balcony. Once she saw that friendly tow truck approaching, she promptly dropped it and shut the curtain. Dissociation from the channels occurs so rapidly that there's minimal cumulative effect over multiple cardiac cycles, resulting in little use dependence and little effect on the phase 0 upstroke. Also, look again at that potassium banana-themed curtain getting pulled in. Class 1B antiarrhythmics actually shorten the phase 3 repolarization by blocking sodium current during the action potential, thereby shortening the action potential duration. No chance of prolonged QT and torsades here, that's for sure. Because of the rapid binding and unbinding kinetics, these drugs are highly selective for tissues with sodium channels spending the most time in the open or inactive state, instead of in the resting state. This makes these drugs more selective for the ventricles and His-Purkinje system rather than the atria, because these tissues have a longer action potential. Let the lit-up ventricular area of the sign remind you of the usefulness of type 1B antiarrhythmics in treating ventricular arrhythmias. Why is the light broken? Well, it turns out that class 1B antiarrhythmics are more specific for ischemic myocardium because the reduced resting membrane potential delays sodium channel transition from inactivated back into the resting state. This results in increased drug binding. So remember the broken heart lamp, evoking the image of a dead area of the heart with surrounding ischemia. And as a little extra reminder that we're treating arrhythmias induced by ischemic heart tissue, check out this other sign displayed in the window. That's a bit harsh. Class 1B antiarrhythmics are useful in treating ischemia-induced ventricular arrhythmias, one of the most common causes of death in the short-term period following acute MI. The most common side effect of Class 1B antiarrhythmic drugs are neurologic, including paresthesias and tremor, or even slurred speech and convulsions. To portray these neurologic side effects, we've made our tow truck driver wearing his trucker hat reminiscent of a brain. She's wearing one too. It looks like there might be a chance for him after all. She may have left the country, but she's still wearing the trucker hat that he got her on their first date. Oh, looks like things are looking up as we take a look at the top floor of the Heartbreak Hotel to meet the occupants of Floor C, the Class 1C antiarrhythmic drugs. Just take a look at this carefree guest. That's the spirit. After a long stay at the Heartbreak Hotel, he's decided to stop wallowing in his sorrows and focus on himself for a while. All right, breakfast in bed. Let these cornflakes remind you of the drug flecainide. But what's that sound coming from the room next door? Let this big purple phone remind you of the drug propafenone, another type 1C antiarrhythmic. Is it a phone call from his ex-girlfriend who's finally decided to break the silence treatment? Looks like our heart-healed patron couldn't care less. In celebration of discovering his self-worth, he clutches firmly onto that jar of peanut butter. Class 1C antiarrhythmics bind avidly to the fast sodium channel responsible for the upstroke of the cardiac action potential, so they are the slowest of the Class 1 drugs to dissociate. This means these drugs exhibit the strongest use dependence, cause a drastic slowing of the phase 0 upstroke, and have a more dramatic effect on the QRS duration. Remember that ridiculously wide QRS trace on the Heartbreak Hotel sign? Since the sodium blocking effect of these drugs intensifies as the heart rate increases, the QRS duration will be prolonged in a rate-dependent manner. Also, take one last look at that potassium-enriched drapery print. Those curtains are untouched. Class 1C drugs do not affect action potential duration. Class 1C antiarrhythmics can treat both supraventricular and ventricular arrhythmias, and notice that the light outside is untouched as well. Both the top half and the bottom half of the 1C sign are shining brightly. A specific supraventricular tachycardia that can be treated with these drugs is atrial fibrillation. Our recurring sketchy symbol for AFib is the irregularly irregular static signal on a television screen, like the one here in the corner of the room. AFib is the most common sustained arrhythmia observed clinically. The initial goal of treatment for these patients is to control ventricular rate, and we will become acquainted with some antiarrhythmics that serve this purpose in later videos. The second objective is to restore and maintain a normal sinus rhythm, which can be achieved by DC cardioversion or by the use of Class 1C antiarrhythmic agents such as propafenone and flecainide. So as he points that remote at that irregularly irregular signal, imagine that he's about to change the channel back to a normal rhythm. Remember, these drugs bind tightly. Prominent use dependence effects of Class 1C drugs can cause a delay in conduction speed that is out of proportion to the prolongation of the refractory period. This can promote arrhythmias, especially in patients with ischemic or structural heart disease. Notice that his flakes are part of a heart-healthy, balanced breakfast. Healthy hearts only, please. Class 1C drugs are contraindicated in patients with any history of structural or ischemic heart disease, especially post-MI, because of these pro-arrhythmic effects. All right, it's now or never, so let's sum up this sketch. Class 1 antiarrhythmics work by inhibiting sodium channels, hence the jars of salty sodium peanut butter. They work on open and inactivated channels, not resting ones. Those spoons are like little inactivating gates, by the way. The upstroke of the cardiac action potential depends on sodium. So as our star soloist tips that mic, remember that sodium channel inhibition decreases the rate of rise of the phase 0 upstroke. The tachycardic heart watch should remind you that this is use dependent. When the tissue is rapidly depolarizing, these agents will bind even more, and that upstroke will tip over even more. This is seen as a widened QRS on the ECG, as depicted by the heartbreak hotel sign. Class 1C binds the tightest. See how he grips that peanut butter jar? So they have the greatest effect on phase 0 slope and QRS widening. Agents on the 1B floor have the weakest binding, so affect these parameters the least. 1A agents are intermediate. The banana curtain represents potassium current that eventually leads to repolarization of the cardiac action potential. Class 1A agents also block potassium. So this curtain is thrown open, the cardiac action potential is prolonged, and you have the risk of prolonged QT and torsades. Class 1B agents actually speed up the repolarization process and close down that action potential duration, while Class 1C agents don't affect action potential duration at all, so the curtain is unchanged. Class 1A are your procainamide prom king, quinidine dining prom queen, and disopyramide newspaper headline. They're good for atrial and ventricular arrhythmias. Class 1B agents include lying lidocaine, the friendly phenytoin man, and Mexican mexilatine. Class 1B antiarrhythmics are useful in treating ischemia-induced ventricular arrhythmias, one of the most common causes of death in the short-term period following MI. Class 1C includes flecainide flakes and propafenone foam.